Hair loss is a significant concern for many, impacting more than just our appearance. It carries deep social and cultural meaning that can affect our confidence every day. While it is normal to lose about 100 hairs per day, our scalps hold about 100,000 hairs in a constant, remarkable cycle of growth. Each hair typically grows about half an inch per month and lives for roughly 4.5 years before being replaced within 6 months. However, hair loss occurs when this cycle is disrupted. The good news is that many types are actually preventable or treatable with the right care. The most common form is androgenic alopecia, often known as male or female pattern baldness, which is a hereditary condition. In men, this often starts as thinning at the temples or crown. By age 30, 1 in 4 men begins to see these signs. Women experience it too, usually as diffuse thinning across the crown and frontal areas of the scalp rather than a receding hairline. Then there is alopecia areata, an autoimmune condition where the body's immune system mistakenly attacks the hair follicles. This causes patchy hair loss and is most common in children and young adults, though it can develop at any age. Hormonal health also plays a major role. Thyroid imbalances, both overactive and underactive, can lead to significant hair thinning. Nutrition is another factor. Deficiencies in protein, iron, or biotin can cause noticeable shedding, especially if iron levels are low. Certain medications like chemotherapy, anticoagulants, or beta blockers can also trigger temporary hair loss during treatment. Physical or emotional stress, surgery, or even childbirth can lead to a widespread shedding called telogen effluvium. Other causes include trichotillomania, the urge to pull hair, or scalp fungal infections like ringworm, which are often treatable. The good news is that understanding the root cause is the first step toward finding a solution that works for your unique situation. Diagnosis typically involves a medical history and physical exam, sometimes supported by blood tests to check hormone or iron levels. For pattern baldness, topical treatments like minoxidil or oral medications like finasteride can effectively stimulate hair regrowth. Advanced cases may benefit from hair transplant surgery, which relocates healthy follicles to areas of thinning for a permanent solution. Autoimmune patches are often managed with corticosteroid treatments to calm the immune response and encourage new growth. When the cause is nutritional or hormonal, addressing the underlying imbalance often allows the hair to recover naturally over time. At Oasis Dermatology, we believe in early intervention. The sooner we identify the cause, the more options we have to help you. We are here to support you with expert care and personalized treatment plans tailored specifically to your needs and goals. Don't wait to feel like yourself again. Visit oasisderm.com or call 956-971-0404 to schedule your consultation today.